Gentleman yields back, and now recognize the gentlelady from Illinois, Ms. Kelly.
Thank you, Mr. Chair, and I want to thank the chairs and ranking members for your insights on the challenges and successes we've had faced in strengthening our response to the COVID-19 pandemic, and excuse my voice. And I want to thank the witnesses for all the work that you do. Vaccinations have proved to be a powerful tool. The Biden administration's decision to make vaccinations free was a pivotal step in our continuing journey toward health equity. In response to reluctance in communities of color to get vaccination, the evolution of COVID-19 messaging created opportunities to address challenges and create strategy around increasing confidence in public health messaging for Black and brown communities, including continued efforts to increase vaccination rates and booster compliance. Still, bivalent booster rates continue to lag, with 19.4% of Black communities, 12.7% of Latino communities receiving updated boosters as compared with almost 30% of white communities. Dr. Walensky, considering the pending PAPA reauthorization, are there key learnings from COVID-19 that will help to increase Black and brown awareness and uptake of public health strategies during the ongoing pandemic and other future public health emergencies, because there will be others?
Yes, there will be others. Thank you for that question. Among the key points of our CDC moving forward is creating partnerships, results-based partnerships, and part of those partnerships is working with community-based organizations, recognizing that people know how their communities will react and people know their questions that they'd like answered. We do have programs like Vaccinate with Confidence, race and ethnicity access to community health, Let's Rise, promoting vaccine confidence. So all of these things are working within communities with people from those communities to understand what it is, what are their questions, the local questions that they have related to vaccine confidence. It's a concern not only for COVID-19, but also for other routine pediatric vaccinations as well.
So I know COVID's not over, but it's waning. So do you see that continuing, or we just did that during COVID?
Those efforts are continuing not only through the bivalent boosting, but we always have a vaccine campaign for flu vaccines every year, and then we really do have work to do in our pediatric vaccines. As has been noted, we lost pediatric vaccination rates this year down from 95% 2 years ago, 94% last year, 93% this year, 250,000 less children entering kindergarten with their routine vaccinations being up to date.
Thank you. How do you say your name? Tabak, I want to be correct. Dr. Tabak, can you elaborate on how initiatives such as NIH's SEAL Community Engagement Alliance against COVID-19 disparities increased clinical trial diversity for COVID-19 vaccines and treatments?
Yes, I'm pleased to do that. What we did was we partnered with local organizations within the community, faith-based organizations and other community leaders, people who are trusted, and met with them to explain basic questions about COVID, about therapeutics, about vaccines, and importantly, why it's important to participate in clinical trials. We wanted our trials to represent the nation, and that, of course, gives better comfort to people that a particular intervention may work if they know that somebody who looks like them was part of the trial. We're building this into everything that we're doing now at NIH. We're not stopping just with the COVID response, because obviously the same tenet holds true for all clinical research. And so we're working hard to extend that.
I'm glad to hear that, because I was going to ask, how can the successes of these efforts be replicated to ensure racial and ethnic diversity in clinical trials more broadly? So I'm glad you're continuing. I just want to say thank you again. This is very important to me, and I look forward to partnering in a bipartisan way with my colleagues to ensure clinical trial diversity. Thank you. I yield back.